maybe we'll have them supine. So what we're gonna do is we're gonna rest their arm on the bolster here. Now for pronation, what is our typical range of motion? It's kind of like 90, right? So the patient should be fully into pronation, 90 degrees, okay? Here, I'm gonna stabilize the distal radius and ulna. Concave here. This is convex is moving on concave. So to get into neutral here, I'm going to push the anterior glide to improve what? Wrist extension. Okay. Then for supination, then I get the patient in supination to work on wrist flexion. Some patients don't have full range of motion for supination. So you're going to be in whatever position the patient's range is, and you're going to direct the force posteriorly because it's an opposite rule for flexion. Just for practical reasons, most patients are lacking extension, which negatively impacts them functionally. Go to grab class, you're in wrist extension. A lot of functional things we do is wrist extension.
Oh, yeah.
Okay.
Like driving.
Yeah. So here, I'm gonna take my second MCP, I'm gonna line it up in the middle of her wrist, and I'm gonna direct that force down. Okay, you okay? So that is the posterior glide, which is going to increase wrist extension.
Oh, okay.
Now, with any joint mode, our goal is to gain range. So I'm teaching you at a neutral position, but as the patient progresses, we could potentially move them into more wrist extension and provide that glide as we move them up. For wrist flexion, I'm going to stabilize again. Now, Lexi's got great neutral range, but if most patients don't have full range there. So if she was only about 70 degrees into supination, I'm not going to force her because that's going to compensate at her shoulder. Leave her there. I'm going to stabilize, and I'm going to direct my force this way, okay? So I'm going to do a posterior glide to help with wrist flexion. Make sense?
That's only if we can.
That's only if they can. If they can fully go and they're